my. Let's see. So, which of the following is the most appropriate initial management for this patient's postpartum depression? Okay, cognitive behavioral therapy, citrulline, lorazepam, lithium, olazapine. Okay, so initial treatment for postpartum. Okay, so a 28-year-old woman presents to primary care 6 weeks after giving birth to her first child with feelings of sadness, difficulty bonding with her baby, recurrent thoughts of being a bad mother, decreased appetite, difficulty sleeping, even with the baby asleep. Her physical examination are unremarkable. Physician rules out psychiatric and medical conditions. Which of the findings was appropriate initial management of postpartum depression? Okay, so I know that like after 2 weeks, so I know it's normal postpartum blues after, less than 2 weeks, but greater than 2 weeks is going to be postpartum depression. So, if you gave, I mean, so I'm trying to think if it's going to be like a safe approach and like you talk it out kind of with them in CBT, or if you do some kind of depressive, antidepressant medication, which would be citrulline, lithium would be more bipolar.
Okay.
So, and then, yeah, those would be gone. Antipsychotic versus benzo. So yeah, so I'm between those two, and I don't know if you take a stronger approach with like an antidepressant or if you like cognitive behavioral therapy. I assume if it's saying initial management, well, or would the doctor just say, here, take these meds? I don't know. I'm stuck between those two.
Sure. What is your gut leaning towards? So let's say like, postpartum depression, right? They give you, so you're lucky that, not lucky, but we're lucky that the question gives us the diagnosis. So you're guaranteed that you have a diagnosis, right? You always start there. So diagnosis, postpartum depression. Okay. So depression. Okay. I practically put it in the same realm of depression. If someone is diagnosed with clinical depression, what do you always want to start first?
Citrulline? Or
Okay. Is that your gut answer choice?
uh I don't know because I've seen cards that include that plus CBT, so I don't know.
Yeah. So best answer is always right. Just think of it clinical major depressive disorder, right? Or postpartum depression, right? You always want to give a medication because remember this is it's like it's a very severe thing, right? Just always remember if you meet, I always say Siggy caps, right? Do you remember that mnemonic, right? Siggy caps. So you need 5 out of 8 for 2 or more weeks, right? Sleep, interest, guilt, all that stuff, right? Energy, appetite, concentration, suicidal thoughts, any of those, right? So 5 out of 8 of the Siggy caps mnemonic, right? And with more than 2 weeks, then that is clinical depression. So this patient has clinical depression. You want to treat it. Okay. You definitely want to treat it with a medication. CBT is always good. Cognitive behavioral therapy is good. It's always a supplement, right? But just remember, right, if you are clinically diagnosed, then you got to start with medication.
Gotcha.